My name is Allison Duffy, and we're doing a presentation on hypertension, which is also known as high blood pressure. Hypertension can best be described as blood pressure that is higher than normal. There are two sources of hypertension. There's essential hypertension, which is high blood pressure that doesn't have an underlying cause. And there's secondary hypertension, when the direct cause for hypertension can be found, and usually this is from a disease. So, talking about hypertension, what numbers define hypertension? So, we're going to discuss diastolic and systolic readings. Underneath the heading, you'll see an example where it reads less than 120 mmHg. That top number you see highlighted in yellow is your systolic number. That's always going to be above the diastolic number. And you'll see it reads less than 80 mmHg. Usually anything under those two numbers are considered healthy unless they're considerably below either 120 or 80. Systolic blood pressure is described as the phase of the heartbeat when the muscle contracts and pumps blood from the heart's chambers into the arteries. Diastolic blood pressure means that this is the phase of the heartbeat when the heart muscle relaxes and allows the chambers to fill with blood. And that's what these two numbers represent. To go into a little further explanation, there are 5 main blood pressure ranges. According to the illustration below, this shows these main blood pressure ranges. To start with, we'll go over normal blood pressure range. Normal can be considered 120 over 80 or less. Now, you're considered pre-hypertensive if you're anywhere between the ranges of 120 and 139 over 80 to 90. Now, you'll go into high blood pressure status, and this is going to be the stage 1 of hypertension between 140 and 159 over 90 to 99. So, when you go into stage 2 hypertension, you're going to be anywhere in the range of 160 plus over 100 and then plus. It's considered a hypertensive crisis and an emergency state if you're over that range of 180 over 110. So you may be thinking to yourself, what happens in an individual that has hypertension? What physical characteristics describe hypertension within the body? Now, when an individual has high blood pressure, the force of their blood pushing against the walls of their blood vessels is consistently too high. This prohibits oxygenated blood to properly flow throughout the body. Now, if you look at the image in the upper right-hand corner, this shows the constriction of your blood vessels, and it restricts the oxygenated blood being forced throughout the body. Now, when your heart beats, it creates pressure that pushes blood through a network of tube-shaped blood vessels, and that's what this image describes, like talked about in the upper right-hand corner. Now, this includes arteries, veins, and capillaries. This pressure is a result of two forces. The first force, like we discussed in the previous slide, is a systolic pressure. And the second force is the diastolic pressure. There are several different factors which can cause hypertension. Obstructive sleep apnea, kidney disease, adrenal gland tumors, thyroid problems, congenital birth defects in the heart and or blood vessels, certain medications including birth control, cold remedies, decongestants, over-the-counter pain relievers, and other medications can also add to hypertension. Illegal drugs such as cocaine and amphetamines can cause hypertension, and there are several risk factors that can help lead to hypertension.
There are many factors that increase your risk for hypertension. Age, so those over the age of 65 are more prone to developing high blood pressure. Race, those of the African American heritage are more likely to suffer from hypertension. Genetics, those with a family history of hypertension are at risk. Being overweight or obese, the more blood flow throughout the body to supply an adequate supply of oxygen. Not being physically active, so since your heart's a muscle, the harder your heart has to work, puts you at more risk of hypertension. Too much salt in your diet, too much sodium in your diet can cause your body to retain fluid and also cause the arteries in your body to constrict, and both of these increase blood pressure. Too little potassium in your diet, drinking too much alcohol, so activating your adrenergic nervous system, causing constriction of blood flow and simultaneous increase in blood flow and heart rate. High stress, using tobacco, and certain chronic conditions. This disease is often called or referred to as the silent killer, simply because there are not, or a lot of people do not have signs or symptoms of hypertension, even at high levels. And if there are, some people have headaches, shortness of breath, or nosebleeds, but these aren't really disease specific. Earlier, Allison mentioned things that can cause hypertension. In this slide, we'll be focusing mainly on just the diseases that can influence or cause hypertension. We found the main three are chronic kidney disease, adrenal and thyroid disorders, and renal artery stenosis. There are many more, but these were the main three that we found. Maybe wondering what complications could arise from hypertension, and some that we found were heart attacks, aneurysms, heart failure, weakened and narrow blood vessels in the kidneys, thickened, narrowed, or torn blood vessels in the eyes, metabolic syndrome, trouble with memory or understanding, dementia, and cardiovascular disease. The burden of hypertension on the world, on the national level and on the state level, is a very significant amount, or a significantly high amount. On national level, there's 33.5% of adults that have high blood pressure. That's 1 in 3 Americans, or you can say 85 million people. This chart shows that there's a significant trend, or a significant increase in trend by age, and there's significantly different from women within the same age. On the state level, in Tennessee, there's 38.5 adults that have high blood pressure. More than 50% of adults 65 and up in Tennessee have high blood pressure, which is also demonstrated in the graph. By 2030, Tennessee is projected to have 1,714,690 cases of hypertension. Populations at risk for hypertension include the elderly. Up to 90% of people over 50 develop high blood pressure. African Americans, in which hypertension's onset tends to begin earlier in age. Women 65 and older. So elderly women are at higher risk of being hypertensive than elderly men. And men who are 65 and younger, men that are under 65 years of age are more likely to develop hypertension than women under the age of 65. All right, here are some resources that we used to complete this presentation. Thank you for listening.